Pakistan Business and Professional Council, Abu Dhabi, invites Dr. Faisal Arshad and Dr. Farhan, Dr. Muhammad Farhan, family physician and family medicine expert and informatics medicine. Let's start first. Bismillahirrahmanirrahim. In the name of Allah. Bismillahirrahmanirrahim. Allahumma salli ala sayyidina Muhammadin nabiyil ummi wa alihi wa sahbihi barik wasallam. Inna a'tainaka al-kawthar fasalli li rabbika wanhar inna shani'aka huwa al-abtar. Sadaqallahu al-aliyyul azim. Pakistan Business and Professional Council, Abu Dhabi. This is their program brings sixth webinar, in fact, with the health update. And this is conducted by Dr. Sayyid Muhammad Farhan and Dr. Faisal Arshad. They are family medicine specialist and informatics medicine, and Dr. Faisal Arshad also a specialist in family medicine. And Dr. Ahmad will take he's an endocrinologist and he'll take the call. The topic today is very, very important, and I hope that most of the people and board member will join to take a benefit of this webinar. The topic is prevention and treatment of diabetes, mellitus, and its complications. So now I'll give our president, Dr. Syed Kaisar Anis, to give a welcome speech and hand over the program further to Dr. Muhammad Farhan, our VP, Vice President, Pakistan Business Professional Council for Membership Committee. Thank you. Over to you, Dr. Syed Kaisar Anis.
Assalamu alaikum, everyone, and good afternoon. Thank you very much, Iqbal Naseem, for introduction. And I welcome all the participants, and especially our speakers, a renowned speaker on medicine, Dr. Farhan, who's leading our council for many years for the membership and especially on the health decks. I'll come later more detail on that. Dr. Faisal Arshad from family medicine and Dr. Ahmad. Pakistan Business Professional Council is since pandemic started their health decks for improvement and control of pandemic. And they have really appreciate Dr. Farhan for providing his services in this respect and updating our members, community, and everyone. And we comment to him for every now and then updating the members and the community. Certainly the benefit is there, and you can see how quickly in the United Arab Emirates this COVID-19 has been controlled. And we are, in a way, I can express and proud that we are in a way a leader on that. How I can say that when the expo was starting on 1st of October 2021, the world was closed. The world was closed because of this COVID-19, and everyone watching whether 1st October 2021 it will start or not. And with a bang, it started, and then the whole world slowly opened. But the leader was United Arab Emirates. I must say that, and I must commend the health ministry, the rulers, and all the authorities for doing great work on pandemic, and rather shows way to the international world how to attend this. This small nation has gone so much work on the pandemic, and not only for UAE, they have worked for all over the world, and we are very thankful to them. Coming to the subject of diabetic is one of the subject which is honestly is the way we say is a cancer for the human being, and this has to be taken care. And I again thank Dr. Farhan and the team to have this topic for the benefit of all our members and the community in the of course UAE and in the globally. Diabetic is one precaution should be taken care. And with this fast running life, because everyone has a target to achieve every morning and everyone has challenges, the health of the person is being neglected. It includes myself also. And a person, if he can do exercise every day in the morning and limit their food intake, they can control and they will not reach to the level of diabetic or blood pressure or the other diseases. So I, as a president, Pakistan Business Professional Council, and on the health test, request all the participants who are listening or hearing or those goes on a Facebook, that please take care of the health, focus on your health, and do at least 30 minutes exercise daily as you're taking in food intake. If you do that, you will not come across all these diseases. I'm giving back to Dr. Farhan to start the program and guide you all on this, on the diabetic, which is really bad for everyone, and everyone is suffering on that account. And hopefully they will look into it and focus on their health first before other things. Thank you very much.
Assalamu alaikum, ladies and gentlemen, honorable audience. It is my great pleasure to welcome you all. Always Pakistan Business Professional Council is always very actively participating to give the awareness for the health issues, health awareness in the community of Abu Dhabi and all over the world. From the pandemic we started, like 2019, we think that this is the time we have to give more and more awareness in health awareness in the programs, and we do the awareness for the public, how to be healthy and how to save your family, save your elders, and whatever the pandemic disease may come or will come, we will take care of it. My name is Dr. Muhammad Farhan. I am Vice President, Pakistan Business Professional Council. And today we had a discussion with the committee that diabetes is the main topic after COVID. So we have to raise the awareness, because after pandemic, diabetes, mostly the people stays at home, less physical activities. So this is the major risk factor. So we will start today's topic. And today's topic is prevention and treatment of diabetes mellitus. So you can go ahead. Prevention and treatment of diabetes mellitus and its complication. Change slide, please. Just I want to give you slightly idea about diabetes mellitus. Diabetes mellitus is very, very, nowadays very spreading disease. Around 422 million patients affected in all over the world. Out of 1.5 million to 1.6 million deaths due to this diabetes and its complication per year worldwide. Diabetes is an autoimmune disease, and diabetes have ethyl. My agenda for today is what is diabetes, type of diabetes, risk factors, sign and symptom of diabetes, diagnosis, treatment, and lifestyle modification. Next, please. What is diabetes? Diabetes mellitus is a chronic disease that occurs when the pancreas, which is the part of our abdomen, one organ which controls the insulin, is no longer able to make insulin proper or less insulin. And when the body cannot make use of insulin, it produces. Insulin is a hormone that helps the glucose of the food we eat pass from the blood into the cell to produce the energy. This is very important hormone for our body health, body energy, and body mobilization. Not being able to produce insulin or use it effectively relates to increased glucose in the blood. If the glucose level, I will explain you the normal ranges. If the glucose is low or high, it affects the body in a very harmful way, and it affects our major body organs if the insulin less and glucose is high. So when there is a disproportion for glucose high in the blood, it affects eye, major organs of the body. It affects the kidneys, it affects the nerves and the mental health. Untreated high blood glucose from diabetes can damage nerve, eyes, kidney, and other organs. Change, please. There are 3 or 4 types of diabetes. Type 1 diabetes means diabetes type 1. It is mostly affected the children. That means the autoimmune disease automatically destroys the cell in the pancreas, and insulin is not there. So that's why we have to give insulin for these kind of children and young adults. Type 1 diabetes means there is no insulin cells in the pancreas and it's only treated with insulin. This is mostly affected by the children and young adults. Type 2 diabetes occurs when your body becomes resistant to the insulin on your body, and this is the most common cause of diabetes, and it affects the adult and is more common, 95%, and it affects from 30 years to 60 years to 70 years of adult. Pre-diabetes is a one kind of a stage that is the means the before type 2 diabetes. Your blood glucose levels are not very high or not very low, but it is above the normal level, and it can be diagnosed as pre-diabetes. When I will tell you the ranges, you will understand properly. Pre-diabetes means those guys who have weight gain, who have less physical activity, and who are more prone that in the future they may have diabetes. So once we do pre-diabetes, they have to increase physical activity, exercise, diet, sugar control, so they will not go and change their disease to permanent diabetes mellitus type 2. Gestational diabetes is also the one kind of diabetes, but this affects only during pregnancy, that caused by insulin blocking hormone produced by the placenta. This kind of diabetes goes away after the pregnancies if we handle the lifestyle modification, and it will not reoccur again if we do physical activity, and after the pregnancies if the female maintain their sugar level with diet, exercise, and follow up with monitoring the glucose. Change slide. Now we will discuss the risk factors of diabetes. The risk factors of type 1 diabetes normally are family history, injury to pancreas, which is by the infection, trauma, surgery, presence of autoimmune antibodies. That means autoimmune means the body itself harming the cells of the body, physical stress, any surgery, illness, viral infection, and exposure. Risk factors of type 2 diabetes mellitus are family history, which is a very important background, Black, Hispanic, Native, Asians, American, and Pacific. The risk factors of diabetes are very high in countries like China, India, Bangladesh, Sri Lanka, and Pakistan. The less affected countries of diabetes are Europe. Overweight and obesity, believe me, I'm telling you, is the major risk factor. If you are overweight, like your BMI, height and weight index is more than 28 and above 30, you have more than. So that's why we are saying every month you check your weight and your BMI should be 25 to 27. Obesity and physical inactivity are the major risk factors nowadays. Mental stress is a risk factor, high BP level, cholesterol high, age after 45, having gestational diabetes in pregnant women, and history of heart disease and stroke. Okay. Smoking also is a risk factor for diabetes. Once you feel, how you will go to the doctor and what are the signs and symptoms you feel in diabetes mellitus? Means signs and symptoms that at night, in middle of the night, if you awake for urine pass or for thirsty, you feel thirsty mouth, like you want to take water, you feel fatigue, your weight loss, you feel very hungry, headache, dizziness, very tired, and you have easily infection, your wound healing or your cut or any small cut delays. These all may show you have a sign of diabetes. So if you have these signs, I repeat it again, that in night awakening for urination, you are thirsty at night or a day, you have a weight loss, you have a fatigue, dizziness, muscle pain, blurry vision, numbness in the feet or in the arms, you have more infections happening, you have a cut or a small bleeding wounds not healing. So these kinds of signs and symptoms, you have to go to your family physician and you have to check your diabetes, and we will explain you how we check. But sometime if you are active, so diabetes is there, but you cannot feel any symptom. So that's why after 40, we say every year or every 2 years, you have to get your blood works done. How we diagnose diabetes mellitus? Diabetes mellitus can be verify or diagnose in many ways, but the first 4 important factors is once you go to your doctor, you should be 12-hour fasting. Water you can take during the fast, and check your fasting sugar, which is fasting plasma glucose test is done, 8 to 12-hour fasting. You can do after 2 hours of eating also, which is called the random glucose test. The third one is HbA1c. That means you have to take an average of 3 months sugar average. This should be 5.5 to 5.7 fasting. Then you have to do the oral glucose tolerance test. In this test, what we do, the blood glucose level we take in the fasting state, then we give you a sugar drink, and after 2 hours, we will check again. So we will check normally within 2 hours of whatever you intake, your blood sugar will be normal. But if after 2 hours pass and we day the sugar random will be high, so that means you have oral glucose tolerance test positive. For type 1 diabetes, we are taking urine samples also. We are taking, because normally the sugar is not coming in urine, but when you have type 1 and type 2 diabetes and it's more high range, we will feel that we will find that urine also have glucose positive. Gestational diabetes, also we will do the glucose tolerance test. So these 4 and 5 area, but important is fasting glucose, random glucose, and HbA1c and urine routine. These tests immediately give us the pattern that where you are standing, what's your diabetes, and age, and HbA1c is the major predictor of treatment. Diabetes can harm the kidney. So with the test, we are doing lipid profile, we are doing liver function test, and we are doing the kidney profile to save the kidney. How we diagnose the diabetes, this is the very informative chart and guideline that when you have diabetes, because mostly community people, while checking the sugar at home, they are very much confused about it, that I have diabetes, I have pre-diabetes, I have non-diabetes, where I am standing. So remember this thing, whenever the fasting glucose test less than 100, this is normal. Once 100 to 125, it is pre-diabetes, and more than 126, it is diabetes. Similarly, if random glucose test less than 140 is normal, 140 to 199 is pre-diabetes. As I told you that you are not having diabetes, but you can change to diabetes, and 200 or above is you are confirmed diabetes and you have to start the treatment, which I will explain you. HbA1c less than 5.7, I told you this is the 3 months ratio. And once you have less than 5.7 HbA1c, then you are non-diabetic and you continue your life with diet, physical activity, and maintain your weight. Normally, I tell my patient that if you are doing 3 things, you never become a diabetic patient. That if you do daily workout or exercise, 8 hours sleep, control your sugar after 40, and make your HbA1c every 3 to 6 months and keep it 5.5. Once HbA1c is less than 5.7 and your weight and BMI is less than 26, you have very, very less or rare chances of diabetes. This chart I need. Chart again. Oral glucose tolerance test, less than 140 normal, 140 to 199 in a oral glucose is pre-diabetic, and more than 200 is higher. Remember one thing, the pre-diabetes HbA1c, if 5.7 to 6.4, it is pre-diabetic, you have to be alert with diet and exercise. But if 6.5, you have to start the oral medications. So we have the steps of the treatment I will explain you. And at the end, when Dr. Faisal will come, they will explain more about diabetes. 2 things which is very important, I want to explain you here, that mental health and stress factor also give us a very important role in the complication of diabetes. So whenever you have diabetes more than 6.5, every year you have to go to the eye specialist to see your eyes, because there are the cases which diabetes affect the eyes, called as diabetic retinopathy. And diabetic nephropathy means you have to go to nephrologist to check the kidney every 2 years. And number 3, you have to take care of your nerve, because nerve become weak, the muscles become weak. So you have to see the neurologist, and we give a supportive treatment with a Neurobion and exercises. Now we come to the treatment. Ethyl. For all type of diabetes, we have one important thing, which is healthy eating. Healthy eating is very important for the treatment because whatever you eat, it can change into carbohydrate, it can change into fat, it can change into glucose. So focus on fruits, vegetables, and protein diet instead of fried food, instead of oily food, instead of more sugary food and all. We have to cut down your carbohydrate, cut down your fat, and cut down your sugar. Physical activity or walk weekly minimum 4 times is very important for the body. It gives you less stress, it gives you more active and control the diabetes. This is the one major treatment of diabetes is diet and exercise. Nothing can compare it if you control your weight, control your exercise pattern, control your stress, and control of food. So first, immediately when pre-diabetes there, we sometimes if no obesity, we don't give tablet, we give lifestyle changes, diet changes, sleep more, and less stress. Type 1 diabetes treatment is, I told you, this is the receptors insulin destroyed there and there is no cells for insulin. Stay here. Insulin pump, we used to give insulin in type of diabetes, we used to give insulin pump, frequent monitoring of the blood glucose, and we have to very restrict the carbohydrate counting. And in some cases where insulin, after insulin is also not working and the pump fail and the last stages of diabetes, we give the islet cell stem cell transplant and we think about pancreatic transplant. Type 2 diabetes. Type 2 diabetes, normally we start, as I told you, when HbA1c is more than 6.5, we have to give diet and exercise plus oral medications. If the kidney function is normal, we start with glucophage, which is metformin. We start with diet, exercise, one oral hypoglycemic agent and continue to monitor it. But sometimes if one tablet is not able to achieve the target, we add one more molecule. So we will add 2 tablets of diabetes medicine and try to get HbA1c from 6.5 or 6.8 to 5.7. Within 3 months, normally we achieve our target with diet and exercise. If the HbA1c is continuously high, more than 7.5 or 8, we start considering adding insulin also, because if more than 6.5 HbA1c and high sugar, we have to save our eyes, we have to save our nerves, we have to save our kidneys. So remember one thing, that initial treatment of diabetes type 2 is diet, exercise, then oral medicine. And if oral medicines fails after 6 months and HbA1c's continue rise, we will add insulin to immediately control the diabetes. If more obesity patient, more than 35 and 40 BMI, means the weight is more than 110 and 120, then insulin also sometimes not work. So we have to do the bariatric surgery to decrease the weight. As the weight decrease and as we start the physical activity, the HbA1c target will be back. Our main target of HbA1c is 5.7. Remember that. So this is slightly idea about the diabetes. We will take the questions and answers at the end. And if you have anything, you can write it down and I'll include. Last, my slides is depends, which is very important, is lifestyle modifications in diabetes. Remember, in my earlier presentation, I told you that diabetes is a chronic disease we can control. We can't treat properly, but for whole life, we have to take care and we can control and live healthy life. So manage your diabetes. Diabetic education is very important. You should know what is diabetes. You should know how diabetes will increase and how you manage your diabetes. Choose healthy food, a good caloric diet. Choose physical activity. Minimum 30 minutes of moderate physical activity 4 times a week is very good for controlling the diabetes. Schedule every 3 months doctor visit if HbA1c is more than 6.5. But if 6.5 less control, continue the medication, and every 6 months you can visit your family medicine physician, specialist, or endocrinologist. Keep your vaccinations update, because sometime I told you if you have diabetes, so you have more infection chances and less wound healing. So the flu vaccine, pneumococcal vaccine, COVID vaccine, all our which are more prone to infections nowadays, you have to take the vaccine to increase the immunity. The wound healing is very important, because if you have HbA1c high and you can see you have a nail infection or foot infection, so sometimes the foot will not heal and some dead cells, and you have to amputate the thumb and all. So that's why we have to take care of infection. Our foot care is very important. Our nail care of hand, nail care of feet is very important. And we have to vaccinate ourselves as per CDC Chronic Disease Management website guidance. WHO are working too hard to maintain the diabetes and give us the updates. So CDC website there, and you can control it. Pay attention to your feet. Foot care every month is very important for those who have obesity or high HbA1c. Similarly, you control your stress, control your blood pressure, control your sugar, control your cholesterol, stop smoking, take care of your teeth. Smoking is one of the causative factor which may increase the diabetes. Take stress less by the plenty of the yoga exercises, by plenty of sleep and physical activity. Thank you very much. This is my slide review about diabetes. And after that, I will invite Dr. Faisal and Dr. Faisal. And Ethel, can you check Dr. Ahmed is here? Because my very good endocrinologist and diabetologist, Dr. Ahmed, is here, and he will give us some point about diabetes. Assalamu alaikum, Dr. Ahmed. Dr. Ahmed.
Assalamu alaikum, Dr. Farhan. Do you hear me?
Yes, Dr. Ahmed, thank you very much for joining me and our Pakistan Business Council, Professional Council platform. But I want your opinion, and I have few questions from the community which I will ask you from diabetes. What's your opinion about diabetes, Dr. Ahmed Abdul Razak? He is a very good, endocrinologist, and he is serving public sector in Abu Dhabi, and he is very good colleague. Yes, Dr. Ahmed, tell me about your experience about diabetes when HbA1c is high. How you treat patients?
Thank you, Dr. Farhan, for inviting me. Okay. First of all, we have to do assessment for our patient. First, we have to diagnose the patient with blood sugar, as you explained previously. It's very important to check the fasting blood sugar and HbA1c. With high HbA1c, this means the patient is diabetic, and we will start to see if there is any complications from the starting or no. Our complication consists of kidney complications or eye complications, heart complications, or even food complications. First of all, we have to do diet and exercise and losing weight and to stop smoking, because this is very beneficial for controlling the patient's blood sugar. After that, we will start the patient with oral hypoglycemic. We will give him metformin to start. This is medicine to lower the blood sugar, and making HbA1c less than 6.5, as you explained before. It is very important to concentrate on lifestyle modifications. First of all, weight reduction is very important, because, as you know, the fat cells make resistant to insulin in the body. So if we lose 10% of our body weight, this make control is very easily, or even it make prevention of the diabetes. Reduction of the body weight by 10% make risk of diabetes less 50%. 50% of
Very
people
true.
risk is reduced by only reduction of 1% of blood sugar, 10% of body weight. Number two, we have to move more, do exercise. Exercise make control of blood sugar is very good, or even you may not need to reach the medications. Number three, you need to eat healthy food. Eat healthy food, avoid all calories, all food with high calories and sugary foods. Number three, you have to stop smoking. If you are a smoker, please stop smoking, because smoking increase the risk of diabetes also. Our medication varieties consists of tablets and injections. A tablet, as we mentioned before, we have a variety of tablets we will give to the patient. After that, we will increase the dose, or even we give combination 2 or 3 medications for control of blood sugar. After that, if it's not responding, we will go to insulin injections. And with insulin injections, we have to take care about the hypoglycemic episodes, because after insulin injections, you may feel a sense of low glucose, like sweating, anxiety, tremors, feeling of heart palpitations. And at this time, you have to take care, because you have to know at this time you have low blood sugar. Okay, thank you, Dr. Farhan. Any question?
Dr. Ahmed, I have one question asked me, one of the attendees, that once the HbA1c is normal, like 6.2 something, they are taking the medication, but the fasting sugar is increasing daily basis, like fasting sugar is 200, 210. So they can continue the same treatment, or they have to increase. So what is important to look at it, HbA1c or a daily sugar fasting?
Yes, you have to take care of both, because actually A1C give us indications for the previous 3 months of control. If your A1C is normal, this means you are well controlled. But sometimes we have certain problems which make A1C is low. Like if you have any hemolytic anemia, any destructions of the red blood cells, this will make your A1C is normal, but your blood sugar is still not controlled. Okay. So fasting blood sugar, if it is high, you have to rechange the medications. We may increase the dose of the evening medications. We may change or add another one. In the evening, it will make your fasting blood sugar is normal. At this time, you will be sure we need always your fasting blood sugar less than 126. If you controlled your fasting blood sugar, this will make A1C normal. And if A1C is normal from the start, hello, doctor, you see me?
Yes.
Yes. If your A1C is normal from the start, this means your blood sugar is well controlled, and you will not go to complications of the eye and the leg and the kidneys.
Thank you very much for attending, Dr. Ahmed. And we are from Pakistan Business Council. We thank you for your expert advice.
I thank you for your invitation for me, Dr. Farhan.
Thank you, Dr. Ahmed. Now I will invite a very good friend of mine, Dr. Faisal Arshad. He's always there in Pakistan Business Professional Council. He already gave previously many good informatics topics of COVID and vaccination and other topics also. So I invite Dr. Faisal Arshad to have a good expert review. He's family medicine specialist in Abu Dhabi. Mike, over to you, Dr. Faisal. Welcome you here.
Thank you, Dr. Farhan. If you can hear me.
Yes, we can hear you. Yeah.
Okay. Yeah, very nice review presented by you about the diabetes, its management point of view, and the signs and symptoms, and the diagnostic criteria used to diagnose the disease and to manage accordingly. My concern primary was here in this presentation will be, people usually think that, okay, once they have diabetes or they are pre-diabetes, like as you described, the early stage of diabetes, is this disease preventable? So if we see, next slide, please. So if you see, diabetes is not a single organ disease, Diabetes happens with multi-organ damages or multi-organ dysfunction together, making our problem, which is hyperglycemia. As you can see, we are focusing in the center. The hyperglycemia means the high sugar level. So if you see different type of cells, the pancreatic cells, the liver cells, our muscle cells, our kidney cells, these all type of cells have dysfunction activity leading to hyperglycemia. And this hyperglycemia in turn is causing damages to all these organs and well. So the recent development in diabetes is also looking at these organs, these cells, to make medicines that can affect these organs to control or to treat our patients with diabetes. Next slide, please. As Dr. Farhan has already mentioned before, and it's very important part of diagnosing and managing diabetes is the weight management. You can see in this chart that as your BMI increase from 27 onwards, your chances of having diabetes for men and female increase in a very rapid way, and then you will be becoming a diabetic patient for lifelong, because this disease is not a temporary disease. Once it is diagnosed, you have to take the medicine for life. This is the biggest problem. So the best approach is to prevent, to stop, or to delay the progression to have diabetes in the future. Next slide, please. So very important in the preventive aspect of diabetes is to diagnose a condition which is called pre-diabetes, or one step before diabetes, which is called the intermediate hyperglycemia, and which is defined as regarding to the HbA1c level, which is should be less than 5.7. If it is more than 5.7 to 6.5, we label the patient as pre-diabetes. As you can see that the prevalence of pre-diabetes is increasing in worldwide, and then by the estimate projection of the patient that will be pre-diabetic by the year 2030 will be around 470 millions. So these are huge burden on the health fact for the country and for the community. So with gradually increasing level of sugar levels in your body, the insulin resistance and the beta cell dysfunctions happens. So the multifactorial risk sources using non-invasive measures and blood test metabolites and glycemic values can help us identify this condition. And once we have been identifying this condition by regular screening, we can reduce the relative risk of diabetes by 40 to 70%. And this is quite, a huge number, which is, is going to control. And the methods, we will discuss it now, how we can diagnose, how we can approach to a patient with pre-diabetes, what we can do, what are the key elements that we look into. Next slide, please. Next slide. So once we have gone, or a patient has been diagnosed as having a pre-diabetes, this chart describes us, how we go about, the behavioral interventions which aim to have a weight loss program by reducing at least 5% of the initial weight, and to putting on certain diets which have evidence that have caused some reduction in the progression of diabetes, are like DASH diet, Mediterranean diet. These diet protocols you can find out on Google, and then you can see that if we adapt these type of diets, the chances of having a diabetes are going to be less. Some criteria, like as Dr. Farhan has discussed, that metformin, a tablet which is used as a first step for the treatment of diabetes, is also being proven with a good level of evidence that if we started it early, then the progression of to diabetes, a complete full-blown diabetes, is around 30% less, which is a good number as well. After doing all these measures, either we start together, diet and lifestyle modification with metformin, we go for a regular 3 months or a 6 month checkup for our patients to monitor their lifestyle. By doing this and enforcing this, we can, delay their, or even we can prevent them from having a full-blown diabetes in the future. Next slide, please. So based on, the evidence and studies, this is a very good review article I read about from Canadian Journal of Internal Medicine, that how they are suggesting what should be the level we should do. Like, for example, patients who have been diagnosed with pre-diabetes, a structured, healthy behavior intervention program with a moderate weight loss and regular physical activity of 150 minutes per week over 5 days is important to reduce around 5 to 10% of the body weight, and it can reduce the risk of developing type 2 diabetes. And as you see, the level of evidence based on the is very high, is grade A evidence and level 1A evidence. Next slide, please. So the second, as we discussed on the chart as well, that although the evidence for these type of diets are not very high, but still we recommend that these are model diets then that we can look into, and we can change our diet. All people will not like to go for a Mediterranean style of diet or a DASH program of diet or a glycemic index control diet. They can look into it, and then they can see what based on their culture, how they can match their diet with the portion size being advised and the caloric or the glycemic index in these diets, and then they can follow these programs to help their sugar levels to be in the level. And then if it is controlled for a longer period of time, the progression to a full-blown diabetes will be less. Next slide, please. The third recommendation in the same article was, as we discussed in the chart as well, that patients with pre-diabetes, starting them early on metformin can reduce the risk of developing a full-blown diabetes, and that has a good evidence as well. As you can see, these individuals who've been started are having an HbA1c level of 6 to 6.4. They are not a full-blown diabetic above 6.5, and they are not pre-diabetes, but they have taken a cutoff around 6. So maybe you can see your patients at what other characteristics they have and what HbA1c level they have, and when to start metformin based on your patient risk. Next slide, please. As you know, they are saying that the type 1 diabetes, as Dr. Farhan has said, that it's early onset autoimmune disease in which your total cells for making insulin being destroyed. And this type of diabetes is not related to most of the time very thin individual, young children, they got this type of diabetes, and there is no intervention to either to prevent this type of diabetes so far or to have modified this type of diabetes. This is type 1 diabetes. Next slide, please. Next slide. This we already discussed. The progression from pre-diabetes to diabetes full blown can be reduced, as we discussed, by metformin by around 30%, and this benefit can be seen up to 10 years of delay in having a full term or a full-blown diabetes. Next slide. Now, people who got diabetes, still they have a chance to delay the medication or to avoid going from more than or a poly medicine by the same intervention as we discussed with pre-diabetes, like taking a healthy lifestyle, reducing their weight, taking proper diet. Education is the key in all these elements. Educating your patients, having a dietitian on board, advising them for their portion of diet, glycemic number, caloric number, ideal weight, they can still be diabetic or without medicine or with medicine as well. Next slide, please. Next slide, please. So as now we have come to know that diabetes is preventable, we can do regular screening checkups. If you have risk factors of developing diabetes, as Dr. Farhan have discussed before, family history, obesity, and lack of physical activity, high BMI, these all risk factors are there. Sedentary lifestyle, lack of activity or physical exertions. You can go for your checkups every 6 months. Early screening for diabetes is a key. So once you do early screening, you will be able to identify your problem better. And once with your consultation with your family doctor, you can manage your disease and you can stop the progression of this disease to a more complicated level. So in diabetic management, once we are diagnosed to have diabetes based on the criteria discussed by Dr. Farhan, your fasting blood glucose level, your after eating blood glucose level, and your HbA1c level, the part comes which is called the management aspect of diabetes. The management aspect of diabetes, in my opinion, is not you can say giving tablets. It's like a comprehensive approach in which, according to the newer advice, should be patient centered. What it means is that you have to involve your patient with the disease to give him an approach or give him a chance to get to know his disease very well, how started, how to prevent it, how to control it, how to manage it, to make him control of his disease. In this way, he will be involved in taking care of his disease and to improve his diabetic control as well. So these are the elements of patient-centered approach, which includes, like proactive approach in health and disease prevention, respecting the patient values and preferences. There are numerous treatment, numerous drugs, mode of treatment for diabetes. If you involve your patient with the treatment chart, like what he wants, not like what you want, or what can be a middle solution between you and him, then there are more chances that the patient will be able to take this medicine and will be compliant and will be controlling his disease. And as we have discussed, that control is important. Why? Because of to prevent the end organ damages. The damages which will be happen because of prolonged hyperglycemia in your body. Some people, like we are working in this environment, we find out that their cards have limit, they have financial problems, social problems, and social beliefs that takes account in not taking medicine or fear of medicine, or their group pressure and everything, so they hide things. So you have to discuss openly with these issues. Very common problem, or you face in that people fear of injection, that they think insulin is very bad, and once they will go in insulin, they will never come back from insulin, and as if they're going to die with diabetes. But all these negative aspects of cultural and patient belief has to be addressed before you start any treatment. So communicating effectively and providing care in a cultural, respectable manner to the patient is very important in having any chronic disease management. Next slide, please. So these are the numbers. As you can see, it's written both in millimoles and in milligrams, just to give you an idea that what we are targeting and what we want to achieve in a patient with pre-diabetes and diabetes. A single reading of 126 milligram or 7 and above, 7.1 millimoles is considered to be diabetic. If you have two readings of random blood sugar level, which is more than 200 milligram or 11.1, then you can say you are diabetic. If you have an HbA1c, which is above 6.5, and your random blood sugar level is above 200, then you can also diagnose a person with having diabetes. Next slide, please. So as we are saying that what are the criteria, as I'm talking before also, that which patient should be screened or should be at high risk of developing diabetes. As you can see here, patient who have risk of cardiovascular disease, patient with diabetes, patient with high sugar, high cholesterol levels, inactive, and women with polycystic ovarian disease, which is POC, it causes insulin resistance and then it can lead to diabetes as well. Patient with pre-diabetics, as we are monitoring them closely as well. Patient who have history of gestational diabetes, they also have a high risk, even they are not pregnant, to change. About 5% of the ladies who are pre-diabetes, later in their life, they will become diabetic as well. So you have to screen them as well. Next slide, please. So, these are the recommendation for the levels that we want to achieve in patients who have diabetes. Definitely HbA1c level less than 7. It is quite, a broader range. based on your patient profile, based on his symptomatology. Ideally, it should be less than 7. The normal value is 6.5. Sometime if you go for a tighter control, your patient will have symptoms of hypoglycemia and can have an hypoglycemic episode that can be life-threatening as well. So they give a range. So 7 is the range that you should keep your patient, most of the patient, under this level. And the fasting level and the postprandial or after eating level, it should be like this. Next slide, please. This is a very complex slide. I know that most of the listeners here are not doctors, so I will just summarize what exactly this slide of treatment means. It has divided the treatment of diabetes is now changed a little bit, not based on the medication preference by the doctor, but by the patient profile. So they have divided the treatment into 2 groups. One who are have no complication or no risk factors like obesity, risk factor like cardiovascular disease, risk factor like renal disease. They have been given the option to start with a monotherapy, the conventional method of treatment, and if not controlled or not achieving the HbA1c level, to go to multiple therapies, and then even if they are very high level, to give them to start with them as basal insulin, that is in the night only insulin, and even if they're not controlled on that, they can go for a fixed dose, split BD dose of insulin twice a day or thrice a day insulin with basal insulin as well. On the other arm, which is on your right hand side, you can see there is mentioned the risk factors on the top of the patients with diabetes, like cardiovascular risk, we have heart failure risk, and the chronic kidney disease risk. So these type of patients, there are certain medications which have come up to be more evidence in having a progression in their chronic disease to be less. Like patients who have kidney disease, starting them or recommendation for them is to start, SGLT2 type of medicine or GLP-1 type of medicine. Patient who have heart failure, SGLT2 is the prioritized medicine for them. And similarly, patient with high cardiovascular risk and more obese risk, GLP-1 and SGLT2 should be given priority compared to the other medicine that we have to control the diabetes. So the treatment has moved around based on the patient profile, his initial blood glucose level, his initial HbA1c level, and his comorbid condition, what we have with the start. Next slide, please. This is also, like a very complex slide, which is showing, the risk and benefits of different medicine. As you can see, for example, the efficacy level, the causing of hypoglycemia, the weight change, how it will bring, is it going to have any bad effect on your heart, like the cardiovascular risk, the cost risk, and is it causing any progression to diabetic complication, which is called DKA, and other manifestation. So all the medicine available so in this chart are graded in this range, and you can go through it. Like, for example, the very commonly, it's not an insulin, but it's insulin-like medicine, which we call it, one example, GLP-1. It is third on your chart. It has a very high efficacy. It has no risk of hypoglycemia. It has good indication for patients who have weight as well as diabetes. And it can be given once a week, and their longer preparations are coming. And in the future, oral tablet form of this is coming as well. And it has neutral effect on heart failure. And it has a but the only, as you can see, high cost value. So based on your patient profile, you can select the medicine from different groups based, which is more beneficial to them and which can be helpful in managing their disease. But very importantly, we have to involve the patient so they know that what disease they are having and what can be done to stop the progression to have end organ damage limitation. Next slide, please. So, diabetes is, now we coming to the part of, we started with the prevention, we discussed the management aspects, and now as we go through the disease itself cause progressive and the complications, or we call the end organ damage stage. These are divided into two major parts, which is like the larger vessel disease and the smaller vessel disease. The larger vessel disease, for the understanding, is your heart attack risk, your peripheral vascular, like having a deposit of cholesterol in your leg arteries and causing, when you walk, you feel pain in your legs and the pulses in the legs become, this is called intermittent claudication or peripheral vascular disease. And the other, the more commonly or the more people know, is the microvascular complication, which involves your eyes, which involve your kidney, which involve your nerves. And these are the two major types of comorbid conditions that limit the patient physical activity, limit the patient from most of the time, and then they can have major life-threatening event because of these complications. That's why diabetes is a multi-systemic disease. It's not involving only one organ. It is like spreading like a cancer in your body to affect all. That's why the control, early detection is very important. So with diabetes, the other conditions that you can have are very important to coordinate and to control these active conditions as well. Next slide, please. These are some conditions either it develops with the diabetes or coexisting with diabetes can have a negative impact on the diabetes management. So, depression, most of the patients, when we saw in our clinics also, after long term of treatment, taking medicine, sometime controlled, sometime not controlled, and the complication, they become depressed. So it's very important to identify those type of people. It's very important to talk about these things with the patient. And if we can, think that they might need support from a psychiatric doctor, we have to refer them. The cognitive impairment, this is, and the term we can explain that the functional capacity of a person with diabetes decrease with time, their brain cells, their alertness, everything decrease, the muscle power. So these all things have a negative effect or negative self-esteem, and then they can increase the risk of hyper and hypoglycemia, which means a very high sugar level and a very low sugar level as well. If they are started to get forgetting, they might take the medicine more or they may take less. So it's very important as with age. So once you identify they have this type of impairment, you have to involve the family more and to discuss this issue with the family and the patient so they will not have these complications. Diabetes are associated with an increased risk of cancer, which is, cancer of the pancreas and the colon, and the cancer of the endometrium in the woman, breast cancer. So these patients should go for early screening of these things as well. Plus, there should be more risk if associated with them, like obesity, smoking, or in physical activity. They should be advised about that as well. Next slide, please. As we know that the periodontal disease, the dental care is very important in diabetic people also. They have a very strong history that they will lose their teeth, they have chewing difficulty, and then it's get worsen, and then they can have abscesses in the mouth and stuff like that as well. So diabetic patients should regularly, every 6 months, should check their dental as well. Patient with diabetes are very common to have liver disease. A very common type of liver disease, what known to people is like fatty liver. Fatty liver becomes more common in patients with diabetes. And these are because of adipose tissue, the fat tissues in our body are not working properly based on the insulin and other fatty deficiencies. The fat is mobilized more and it gets deposited in the liver. With chronic deposition of fat in the liver start to get damaged. And now very commonly, before we know that the cirrhosis or the shrunken liver is a disease of hepatitis B and C causing more. Now we are coming to know as we have vaccine and prevention for these two diseases, diabetes or fatty liver is another cause which is taking lead from hepatitis B and C as a cause of cirrhosis or shrunken liver as well. Diabetic people also, will develop problems with hearing loss as well. Next slide, please. As you have noticed, most of the people with diabetes, they are obese as well. So obesity also has linked with a condition which is called obstructive sleep apnea, in which people snore loud at night, they get choking episodes in the night, and in the day, they have problem in the concentration, and they get sleepy in the office or in front of their laptop, sometimes driving as well. So this risk has to be identified as well and to be addressed and to be evaluated properly in the ENT or the pulmonology clinics. The other very important factor is the fracture risk, which also increases in diabetes. So these has to be monitored because you have vision impairment plus neuropathy, and you forget the sense of your joint health, and you get deformed joint and your easy chance to fall. And if you are having weak bones, then you are more getting the chances of fracture. As Dr. Farhan has also discussed, that all chronic disease like diabetes, the chance of infections in these people are very high. How to prevent them is to have periodic vaccination. Vaccination once a year for influenza, pneumococcal pneumonia or the pneumonia vaccine every 5 years, and hepatitis vaccination should be done for these people as well. Next slide, please. So this is my last slide, and what I can tell you is this is like a comprehensive review of how we diagnose and what is the diagnosis. But the most important thing to concentrate is in the center of the page, that what start is a normal person, how it becomes a pre-diabetic phase, and then to a full-blown diabetic phase. So if you are maintaining your lifestyle, if you are doing regular exercise, eating properly, sleeping properly, the chances of going to this disease is more. Today's lifestyle of fast food, relaxed lifestyle, very less physical activities, that's why we have more prevalence of diabetes in our society nowadays. So with this slide, although there is a lot to be talked, we can talk about diabetes, but based on the time limits and the audience, I think this is the message we should care, that early screening, controlling pre-diabetes, not to get a progressive to diabetes, and once diabetes to control is more important, and involving your patient and family in their care is also the key in managing the diabetes. Thank you very much.
Thank you, Dr. Faisal, for detailed presentation and your expert opinion. And I hope that all the audiences, and after the recording, will put it into YouTube also, they will get more information, and they will treat themselves, and they will monitor and take care of their health. Over to Dr. Kassar.
Thank you, Dr. Saab. Thank you very much, Dr. Farhan, and thank you very much, Dr. Faisal Arshad. I think both of you have done a very comprehensive statements and guidance for all the participants, and this will go along the way. I really admire for all the charts, all the efforts you made, and how good it is for the good health for the community. I have a question. Either Dr. Faisal Arshad can answer. Very worrisome, or very, when anybody will listen, it's scary, you can say. So if they honor you by adopting your steps, by reducing, having more sleep, exercise, and taking proper care, you think they can reverse from 6.5 to back to 5.5? Is it possible?
Yes, it is. See, it is not a completely curable disease, as we have said that it's a preventable disease and a controllable disease. But to keep it from 6.5 to 5.5 is you can do it without medicine. The place where I'm working, we have a senior consultant cardiologist. He's been diagnosed with diabetes because he's overweight, and so last 10 years he's monitoring his blood, and I think for the initial 3 years he took medicine. Now he's maintaining his HbA1c below 6 or 6.2 without medicine. So we will not label him as not having diabetes, but we can label him as diabetes controlled with preventive measures like diet and exercise and lifestyle modification. So, and the risk of complication, it will be delayed. The main problem with diabetes is not the disease itself. It's affecting the multi-organs that is causing the major impact.
Yeah, you're right that this is a root cause. Diabetic is a root cause, destroying all other organs and spreading the disease. And I agree the damage is done by the diabetic is hard to recover. But it's happy news from you that one can make effort, he can come back to his original state of affairs. That's a good news, because if everyone wants to see that he is diabetic and he is depressed already and he thinks, okay, but I personally have a lot of experience. My father was diabetic, and at the age, I was very young age, I went and bring the report from the laboratory from Karachi, and he said, I'm diabetic, and that time urine test was there. And of course, then the diet changes. But the good part of this diabetic is there's a good part of also that you start caring for yourself, caring for your body, caring for your food, and that gives you a long life. That's a good part, because if you, at right time, you test yourself and you think, oh, I'm diabetic, and as you rightly said, you can reverse it, and he's a careful person, he can improve by diet. And my father did it, because he started using all things which doctors suggested. They used to use diabetes that time. There's a diabetics association in Karachi. So he followed on that account. But then the life is gone long because he started caring for himself. Before he was not caring. He was not taking care of the sleep. He was not caring for walking. Now he's caring. He said, oh, I have to do that. And I will add something more to the audience. I just returned from Gilgit-Baltistan. It is 18,000 above the sea level. And I give you my experience. I went for 10 days, completely different environment. It is, you have to go on the mountain, you have to come back a mountain. I reduced my weight. I reduced my feeling. And with this, I'm saying to everyone that, as you rightly said, you can change my lifestyle. One should do a break from his job. He must take a break twice a year, try, and take a 15 days holiday. Take a holiday only, not going back to your this thing. Go someplace where you relax and where you can think about yourself. It's very important. That will contribute and improve your lifestyle, your health, and be happy. When you change from the environment, keep yourself happy and start, although I know everyone must be giving, Pakistanis are known for giving, start giving time, giving good for a relation, giving good for your friends, meet your friends. It will change the lifestyle. Apart from, of course, you have 8 hours sleep, you have exercises, which is basic, but don't love food. Food is the main cause because it is one-way traffic. I see people, you have to take breakfast, you have to take lunch, you have to take dinner, and always food, only one-way traffic. There is no compensation that you have to burn this also. That education I want to give, that you should take food, but you should side by side, have I burned it or not? Otherwise, you're not qualified to take food. If that formula they keep, I'm sure things will be. And from this, from Pakistan Business Council, I think that we are very fortunate. We all citizens in Abu Dhabi and UAE are very fortunate. We have very good health system. We have a health card in your pocket. You can go to the doctor whenever you feel for any small thing. Don't be lazy. You go, the doctor is there to guide. In other countries I've seen, the facilities are not there as we have the facilities. They should use this facility. They should use their health card. They have 15 days sick leave. They should use that leave for your health. So with that, I'm really again thankful to our Dr. Farhan and Faisal and Saidi Abdul Razak, Dr. Ahmad, for such a good guidance to everyone. Thank you so much.
Thank you very much. Thank you, Dr. Faisal. God bless you.
Thank you very much, Dr. Farhan. You took the initiative, Pakistan Business and Professional Council, the whole board member, saying thanks to you, Dr. Faisal, and Dr. Ahmad as well. Keep doing the good work, Dr. Faisal. This webinar was very informative and comprehensive, as our President, Dr. Syed Kasrani, has mentioned. That is very comprehensive. It covered all the areas, you know, from damages to type 1, type 2, and you know, how to prevent and when to start medicine, and what you have to check your BMI, and you know, plenty of things. Once again, on behalf of Pakistan Business and Professional Council, thank you, Dr. Farhan. You are also board member, and Dr. Faisal and Dr. Ahmad. Let's conclude from here. Thank you very much. Thank you.
Thank you very much.